Okay. Hi, my name is Michael Kraus. I'm a professor at Yale University in the School of Management in the Department of Psychology, and I'm a social psychologist. Today, I'm going to talk about the social psychology of inequality. This area of research is a growing area. It intersects not just with psychology and the domains of it, but also economics and sociology. There's a lot of work here, and it's not my intention to fully cover all of it. Instead, I will talk in particular about some of the research that we do in my laboratory and some of the ways in which basically people perceive and misperceive inequality and the implications of those misperceptions for the kinds of policies that people are likely to support in their voting behavior and the like. So we'll move forward with this roadmap where I'll try and talk about a problem to start, and then we'll talk about some of the psychological factors that contribute to how we misperceive inequality, focusing on self and system protective justifying beliefs. We'll then talk about how these beliefs undergird the ways in which we fundamentally misperceive racial inequality in society, and then some efforts to create more realistic perceptions of those inequalities and the challenges therein. So first, I want to talk about this problem. Here's a news article title that's fairly common in coverage of our current pandemic conditions, talking about the tale of two New Yorks. Pandemic lays bare a city's shocking inequities. And I want to focus on this emotional reaction, the shock reaction to inequalities in society that are a function of health and who is more susceptible to infection and mortality as it relates to COVID-19 and our current pandemic. People in service jobs, people who are incarcerated, people who are most vulnerable tend to be most likely to be exposed to this very contagious disease. And those jobs and those communities tend to be disproportionately populated by people of color in the United States. So to say that these social conditions, these health conditions, these health inequities are shocking is a reaction that's common to the inequality we see in our country, our recent inequality. But in many ways, it's shocking to be shocked by this inequity. So first, if you think about the economic history of the United States, the growth of the economy in the United States is based on a system of an economic system that is inherently unequal in the same ways as our current pandemic is unequal. It leads to the accumulation of wealth based on the exploitation of enslaved Africans in the United States. And the genocide and taking of the lands of indigenous peoples. Even codified in our laws in the 1920s, you have like this map, redlining laws that categorize communities of color as existing in real estate locations that are more risky investments. And these kinds of policies persist and lead to a systematic undervaluing of the economic fortunes of people of color in the United States. So at least since the country's founding, we've had a history of inequalities that have been racialized, that occur as a function of race. So the health inequalities that exist currently, perhaps under that lens, shouldn't be that surprising. Also, if you were to just Google inequality in New York, you'd find a lot of information to digest, not just from this year, but from many years previously, many reports. There are many opportunities to understand inequalities in New York that may lead you to this expectation that you might see health inequalities during this pandemic. So what we've got here is a problem where we see inequalities in our health system that lead to disease and mortality, susceptibility among people of color in the United States, Black and brown folks. And the reaction is in the news media, and perhaps by people reading the news, is one of shock. But there is information that's out there that people have that is freely available, people have in their history books, that could lead to a different interpretation. An interpretation that maybe we should have expected these kinds of inequalities to manifest again and again across time. So why don't we have this latter reaction? Why instead are we shocked about these health inequalities? In psychology, we turn to system and self-justifying and self-protective beliefs. So if you are given a choice between unpleasant truths about the world and comforting lies, people tend to choose those comforting lies. If you are forced to admit that you have been unethical or immoral, often you are likely to reinterpret those personal events in ways that allow you to see yourself as more moral, so that you don't have to come to those unpleasant truths about yourself that you've acted less charitably in the past. Suppose we have systems of government in place that give you advantages that are unearned. It's likely that you, instead of contending with those systems of advantage, you might tell yourself some comforting lies about the system, that it has some kinks, it has some problems, but it is trying to be as fair as it possibly can, and if it is unfair, those bits of unfairness are likely to be solved in due course. Some of the more famous work on this kind of self and system protective justification strategy comes from observations in cults. So When Prophecy Fails is a book by Leon Festinger. He is observing a cult that's predicting the end of the world. He observes the members of the cult right before the end of the world is predicted and right after it doesn't happen. And here is what he writes. Suppose an individual believes something with their whole heart. Suppose further that they have a commitment to disbelief and they have taken irrevocable actions because of it. Finally, suppose that they are presented with evidence, unequivocal and undeniable evidence that their belief is wrong. What will happen? The individual will frequently emerge not only unshaken, but even more convinced of the truth of their beliefs than ever before. So when it comes to justifying ideologies in the context of understanding America and its inequalities, justifying all of the ideologies serve the function of elevating myths about the structure of society, what makes people successful, and it distorts realities by having people turn away systematically from the actual realities of society, even the data that's available about society, in service of these myths that serve this self and system protective function for people. They make people feel good about the society they live in and their individual actions, when a real contending with the realities would lead to a different conclusion. So in the context of the United States, we have a lot of beliefs about American opportunity and how it's conceived. These beliefs are reproduced in stories we can tell our children. They're reproduced in our music, in our media. They suggest that people have inherent qualities about themselves and that those qualities are rewarded with time and effort and perseverance, with economic rewards of some kind or another that allow people to demonstrate their success to others. The American dream suggests that society is not perfect, and that there will be hardships, but eventually everybody is rewarded justly for the efforts that they put in. This is a narrative that is captivating in society, but is in stark contrast to the realities of the COVID-19 pandemic, the realities of our existing economic system that has been in practice since the country's founding. So what we are arguing in the context of how people perceive inequalities in society, and particularly racial inequalities in society that have been the context of the United States since its founding, is that these kinds of justifying ideologies about American opportunity beliefs, is that they're going to lead to misperceptions of racial inequality, the magnitude of it. People are going to see society as both more equal and as progressing towards greater equality um, in ways that outstrip reality. So to make this plain, you have on the one hand at the top data on racial inequality, including data on constrained class mobility relative to other countries like Canada. We have data on racial inequality that exposes health inequalities, wealth inequalities in the United States between, for instance, in the topic of this talk will be Black and white Americans. There's wide inequalities. But then on the other hand, you have American opportunity beliefs that say that people get what they deserve and deserve what they get, that society is not perfect, but it's becoming more and more equal over time, and that society is progressing more and more towards justice. This is a myth of racial progress. Caught in between these two sets of beliefs and information, our structural beliefs of society are much more likely, in our estimation, to coincide with our opportunity beliefs than the data on racial inequality. So our structural beliefs are going to be beliefs that suggest that we are moving more towards racial progress. So we're going to overestimate racial progress, and then we're also going to overestimate the extent that we've achieved equality in wealth, in income, in health, and the like. And then the reason, again, why we focus on these structural beliefs in our studies is if we do not comprehend or process or pay attention to the magnitudes of racial inequality in society or the lack of racial progress that we are engaged in, then we don't have enough information, space, or consideration for the policies that might redress these structural barriers, the real economic inequalities in society, with policies like reparations, with policies like the federal job guarantees program and baby bonds that will reduce both income and wealth inequalities between Black and white Americans in society. All right, so our methodology for understanding misperceptions of Black-white racial inequality is fairly simple. We ask our respondents, these are survey respondents collected through panel surveys, and we've done it to survey both Black and white Americans. We've done it to survey a nationally representative sample of Americans in terms of socioeconomic status and race. But we ask basically if the average white family has $100 or 100 of some resource, income, wealth, health benefits, wages, how much does the average Black family have? And we ask our participants to make these estimates on 0 to 200 scales. Here is our initial work on this. These are 3 studies in blue that sample white and Black Americans who are below the median and above median income levels. And then we've got actual progress that's based on the survey, the Consumer Finance Survey and the Current Population Survey. Health benefits, college wages, high school wages, wealth, and income. Differences between white and Black Americans. We asked our participants in this sample to estimate what was the inequality in the past and the present, and then we subtracted from those 2 estimates from each other to get a metric of progress. So people saw things across our 3 studies as becoming more equal across time. These are positive estimates indicating that people thought there was between basically 20 and 35 percentage point units of increases towards racial equality between Black and white Americans. But when you compare these estimates of progress to federal government data looking at actual racial inequalities, what you get is a large discrepancy between what people estimate and their actuals. So, in this contest between how much Americans suggest that we are progressing towards racial progress relative to what the actual data suggests, narratives of racial progress seem to win out in our studies, wherein people suggest that society is moving to be more equal between Black and white Americans, when the data suggests an entirely different story of stagnation towards greater equality. When you look at wealth, the misperceptions are most stark. So this is a different sample collected a couple years later with about 1,000 participants selected to be racially, to represent the United States in terms of race and socioeconomic status. Each individual dot at each individual time point is one person's individualized estimate. And so each person appears in each year, and the years are chosen based on having available federal data on the Black-white wealth gap from the Survey of Consumer Finances. Years for perception are randomly shown to participants. What you've got here are the estimates. Here are the means with 95% confidence intervals. So you can see people increasing their estimates towards greater equality for Black wealth when white wealth is $100 across time. This is racial progress being perceived by our participants on the wealth indicators. And then these red diamonds are the actuals as calculated by the Survey of Consumer Finances. So wealth has not become more equal across time. And wealth is quite different from people's perceptions of wealth inequality, in part because wealth is transmitted intergenerationally. So any prior and current policies that lead Black and white Americans to have differential access to opportunities, including policies of chattel slavery from the past, are likely to show up in these actuals. And what you see in people's perceptions is they are not nearly accurately accounting for the magnitudes of racial inequality that existed in the past, and definitely not accounting for them as they exist in the present in the context of wealth. So these first two studies suggest that people are inaccurate in their estimates of both racial progress and Black-white racial inequality. People see the world as progressing to be more equal and as being more equal both in the past and present in terms of wealth than it actually is. And there are two factors that I want to turn to today that really contribute to these estimation errors. And the first one has to do with our narratives. Our narratives about American opportunity beliefs suggest that society is fair. And so what you get is evidence that justifying ideologies, a belief that society is fair, predict the extent that our individuals in our sample overestimate Black-white wealth equality. So this is a scatter plot showing a correlation between belief in a just world. One of the items is I believe that people earn the rewards and punishments they get, and our overestimates of Black-white wealth equality. So these estimates are calculated so 0 is accuracy, and then positive scores indicate overestimates. And what you get is this reliable correlation between thinking that rewards and punishments are earned and estimates of equality between Black and white Americans. These estimates are robust. This association is robust to a number of control variables, including the race of participants, the income of participants, the educational attainment of participants, the political orientation of participants as well. So these justifying ideologies seem to predict, in a reliable way, people's tendency to see society as more equal than it actually is. A second piece is status. So if you are higher in status in society, then our opportunity beliefs about how you achieve status and how it is determined by your own merits are likely to be particularly appealing if you're higher in status. And that is, again, what we find in our studies. This is data from study 1 of the first research I showed you on racial progress. What you get is high income white Americans are estimating current racial equality at higher magnitudes than low-income white Americans and high and low-income Black Americans. So high-income whites, their highest status in society, they're most likely to benefit from these American opportunity narratives that say it's about your individual efforts and striving that leads to success, who tend to be most likely to overestimate racial equality. All right, now I'd like to turn to understanding how we can create more realistic perceptions of racial inequality in society and some of the causes of those more realistic perceptions. So to do that, I want to go back to our model. And our first study is looking at ways that you make people's estimates of racial equality more inaccurate. One of the ways you do that is you remind people about progress narratives. If you remind people about the passage of time and the unfolding of society and its features, people have a tendency to think that society is getting better. And so just a reminder that society is moving forward in time leads to beliefs that forward progress means progress towards equity, towards justice. And so people, the simple fact of having to estimate racial equality at 2 time points is going to lead to greater overestimates of racial equality as society is currently situated. That's the prediction. So in this study, same methodology. If a white family has 100 in wealth, how much does the average Black family have? But then we have 3 randomly assigned experimental conditions with about 250 people per condition. The first condition is to have people estimate at 2 time points, one in the past, one in the present. The second condition is to give people information about the actual wealth gap in 1963. So Black Americans earn about $6 per 100 white Americans in terms of wealth. Then you ask people to estimate the current racial equality. And then finally, you ask people to estimate racial equality in the current time point only. And we're predicting that those first 2 are going to lead to activation of racial progress, which is going to push up people's estimates. Here's the results. We have means on the dots, and then the brackets are 95% confidence intervals. What you get in both of the 2 time point conditions is an elevation of people's estimates of Black-white racial equality. What's interesting in the 2 time point condition is you get a heightened estimate relative to the current only estimate. In the past anchoring condition, we remind people about the actual racial inequality. You get equal estimates to the current only condition. But what you can see here is people moving their current equality estimates to be much larger in that past anchor condition. So it's racial equality is thought of as, racial progress is plus 54 points in that past anchor condition, which is larger than the 2 time points condition. Both of these findings suggest that when reminded of society's passage across time, people think that passage across time means passage towards greater equity and justice in society. So greater equality between Black and white Americans in wealth, even though that is not what these data, what federal data actually suggests. Our second manipulation, so if American narratives are a strong sort of default way in which we see society and its structures, one thing you can do is you can provide some monetary incentives to people to pay attention to the data that they may already know, they may already have access to. So when you ask about structural beliefs, you might just pay people for some greater accuracy, and that additional monetary incentive would get people to admit what they really know about the magnitudes of racial inequality in society. So we did this, same methodology. Now we have a current only 2017 estimate, and then in our second condition, we're paying the first 5 people, the 5 quickest accurate responses, an additional $100 for getting the right answer. So this should allow people to reveal what they already know about racial inequality. It dampens some of the system and self-justifying ideologies in favor of making some money in this experiment. What you get is a small but significant reduction in people's estimates, so that estimates of black-white wealth equality become more accurate when you pay people for greater accuracy. But I want to caution this result if you're thinking that it's really instructive of like a policy improvement or it's actionable, because you can see the red line there is about where the actual consumer finance survey data says black-white wealth equality inequality is. And you can see in the incentive condition, even when we're paying people $100, they're more accurate, but only slightly so, and they are far off from actually what the data would suggest. So something more than just paying people to be accurate is necessary to get people to really understand the magnitudes of wealth inequality between Black and white Americans. In a final study, what we did is we sought to really try and immerse people in the magnitude of racial inequality with manipulation. So in this survey, we asked people about the racial wealth gap using the same procedures we did in the email. We brought them into the lab and we exposed them to arguments about the magnitude of racial inequality in society between Black and white Americans. And this intervention included real data about the actual wealth gap between Black and white Americans. We also kept them in the lab, our participants, to talk about their own beliefs about the causes of inequality in society, to make it an immersive experience where people had to consider these arguments more deeply. We then asked participants before they left what they thought the racial wealth gap was, given that in the previous intervention we informed them about the wealth gap. And then around 6 months pass, and we ask again in a follow-up survey to see if this lab-based intervention is successful in really changing people's beliefs about racial wealth and equality in society. So that's our design. Let me show you what we found. So around 10 is accuracy in black-white wealth. When white wealth is $100. People again are really inaccurate about black-white wealth inequality. They see more equality than actually exists. Post, which is right after the intervention where we inform people about the actual wealth gap, what you get is some accuracy, but again, you have people overestimating equality even right after, 30 minutes after we told people about the real wealth gap according to federal data. And then when you follow up around 6 months later, what you get is even more decay towards the original estimates that happens here. So interventions that are momentary, that seek to reduce people's misperceptions about black-white wealth inequality are not likely to be effective, in that they're not likely to puncture the continued and chronic exposure to American opportunity narratives, mythologies of racial progress that we're inundated with in our everyday society, and our self and system protective beliefs that lead us to want to hold on to those narratives, even when presented in a laboratory setting with evidence to their contrary. So a few takeaways before we conclude. Our psychology is fundamentally self and system justifying, and we seek out comforting lies to replace uncomfortable truths about self and system. This is in many ways how we function. In some ways it allows us to go on with our lives and be unbothered about the conditions that other people struggle with. So in some ways you could think about it as being self-protective. But in other ways, it's deeply connected to how unjust and unequal society becomes. And in this fashion, psychology contributes to how racism and racial inequality are systematically misperceived, misunderstood, and legitimized in society. And finally, because American opportunity narratives are pervasive, manipulations done in lab, done in a momentary setting, that are small in time course and not immersive, are not likely to have long-lasting effects on people's beliefs about how unequal society is until there is a reorganization in people's narratives. We can't really have space for conversations about real equity enhancing policy. And we are forced to live in a society that is more rather than less unequal. So our psychology contributes to this reality, but it is my position, at least, that some of the work that we do in psychology can be in the service of creating spaces where we can have these kinds of transformative narratives that are more in contact, not with the lies we tell ourselves about society, but with the realities of how unequal and unjust that society is. And it's my hope that through this work, we can create the space for conversations about reparative economic action and justice. I just want to thank you for listening to this. I want to thank my laboratory, the Contending with Societal Inequality Lab, and all the people who worked on this and related projects. Thank you.